Today I just want to give you a brief idea about the principles and ethics concerned with the blood donation and transfusion. I will read a paragraph for you, my friends, so that we understand what's the ethical concern regarding the blood donation and transfusions. The objective is to define the ethical principles and rules to be observed in the field of transfusion medicine. Blood donation, including hematopoietic tissues for transplantation, shall in all circumstances be voluntary and non-remunerated. No coercion should be brought to bear upon the donor. The donor should provide the informed consent to the donation of blood or blood components and to the subsequent legitimate use of the blood by the transfusion services. Patients should be informed of the known risks and benefits of blood transfusion and or alternative therapies and have the right to accept or refuse the procedure. Any valid advance directive should be respected. In the event that the patient is unable to give prior informed consent, the basis for treatment by transfusion must be in the best interest of the patient. A profit motive should not be the basis for the establishment and running of the blood services. The donor should be advised of the risks connected with the procedure. The donor's health and safety must be protected. Any procedure relating to the administration to a donor of any substance for increasing the concentration of specific blood components should be in compliance with the internationally accepted standards. Anonymity between donor and recipient must be ensured except in special situations, and the confidentiality of the donor information assured. Blood donation must be based on the regularly reviewed medical selection criteria and not entail discrimination of any kind, including gender, race, nationality, or religion. Neither donor nor potential recipients has the right to require that any such discrimination be practiced. Blood must be collected under the overall responsibility of a suitable qualified medical practitioner. All matters related to the blood donation and hemopheresis should be in compliance with the appropriately defined and internationally accepted standards. Donors and recipients should be informed if they have been harmed. Transfusion therapy must be given under the overall responsibility of a registered medical practitioner. Genuine clinical need should be the only basis for the transfusion therapy. There should be no financial incentives to prescribe a blood transfusion. Blood is a public resource and access should not be restricted. As far as possible, the patient should receive only those particular components. For example, packed red blood cells, platelets or plasma or cryoprecipitate, whichever is appropriately required by the patient. It should be based along with the clinical support as well as laboratory support. And at least good decisions should be taken before transfusion of these components. Blood transfusion practices established by national or international health bodies and other agencies competent and authorized to do so should be in compliance with the code of ethics. This is the principle of transfusion medicine. I hope you get the crux of my talk. Thank you.